So good morning, everybody. It's so nice to have everyone back this morning, and I hope that you all went out and had fabulously productive dinners. I happen to be part of a dinner with 2 CDRNs, 2 PPRNs, and then patient reps from both the steering committee and the executive leadership committee last night, where we were plotting, to take over the world and all the great things that we're going to do through this network at PCORnet. You know what? It's some of the best things that can come out of these meetings, and so I thank all of you for taking the time. So I'm Bray Patrick Lake. I serve as the patient representative on the PCORnet Coordinating Center Executive Leadership Committee. And this is the most important slide in my presentation. Nobody that I'm involved with ever likes to claim anything that I say. So with that said, I want to refocus us on why we're all here. So patients really dream of a high-quality healthcare system that's patient-centered and efficient, enabling reliable and timely access to evidence-based prevention and treatment options that are responsive to the individual patient needs. And I'll go ahead and just tell you that I don't just think this is puppies, kittens, and rainbows. I do think that it's achievable, and I think it's what brings us all into this room. But there are certain realities to what's actually going on today, and we've heard it. I think every speaker that has gone before me has actually touched on a part of my talk in some way, which is great because we're all from different stakeholder backgrounds, and if we can all agree on some basic things, which I think the system's not really working optimally for anyone, then I think we can come together and start working on some of these issues. I think we'd all agree that there's a waste of resources going on. If you look at the research system, it's failing, costs are increasing, and investigators are pulling out of research. And I don't think any of us are saying that we're getting what we need in the timely manner and the way that we need it. We know that data that is out there somewhere in somebody's files, whether it be Google or in your health system or on a patient network, there is data that is largely inaccessible to patients that we could be using to improve our care every single day. And it's very frustrating that we can't actually get access to that. What's even more frustrating is that when we do have high quality research, oftentimes it's only published in a peer-reviewed journal. It never actually filters back to patients, and we never get it in a way that we can actually use it to improve our circumstances. And then, in the value and cost conversation, there's so much information out there, and to patients, it's largely uninterpretable. We really are not able to say at this point, with all of the information through HCAHPS and different registries, we're still struggling to actually look and say, if I go to this facility and I pay XYZ dollars, they have the best outcomes, this is what I get for my dollar, and this is what I get for being a good patient. We're all still struggling around that. Wow, this talk is really boring if nothing actually happens. Can you auto-advance me, please? Thank you. So this slide is courtesy of Rich Platt. Every single day as patients, I live in a condition where we really don't have trials that have actually been completed and answered the questions in the way that patients need. We don't have any FDA-approved products available to patients in this country that are cardiac devices for my particular condition. And patients are being treated every day. And so what are we doing? Where does this actually, what's going on? Why can't we get the information we need? And there are some very common questions. And you think about, is it really our best guess medicine? Do patients understand what's going on? That there may be a bit of evidence and then really, a physician is doing the best they can to get us information that's not actually really based on anything. And sometimes when there are guidelines in existence, for those of you who know Rob Califf and Judy Kramer, great paper, it's kind of scary to think that actually we do have guidelines that were produced that aren't actually based on evidence that patients might find to be reasonable. And then Holly PA, I thank you for this slide. This is probably one of the more extreme examples that I think we should remember every single day as we pursue our work. So Duchenne muscular dystrophy, these boys, once they reach a certain point, they're getting worse and worse every day. A week actually makes a difference between being on a walker and being in a wheelchair, being able to breathe on your own and being on a ventilator, and then eventually death. So all of us need to remember that there are parents and there are patients sitting out there every single day saying we need answers and we need them right now. And patients can't wait. So in the sea of saying, okay, we don't have evidence, where we actually do have evidence. Some of you have already touched upon the STS registry. We have NCDR in the cardiac space. We've got all of this evidence, but yet we collect in TVT registry, which is a transcatheter aortic valvular registry. I think we have 483 data elements. They are actually being published, and at the end of the day, patients still can't make a decision. Some of this information actually then gets reinterpreted, and it goes out into, in Consumer Reports, I believe they were doing a 1, 2, or 3 smiley faces. You know, what does that tell me about my care as I actually make a choice? I really have no clue, and I think we really need to get smart about what we're collecting. Can we identify the elements that actually make a difference to patients and help physicians improve care? And our QI initiatives, it can't just be collect everything. We've got to actually make this data get a lot smarter and work for us. And so this is Mike Mack, who used to be president of STS, and he actually had this really nice commentary piece. And you know, it's amazing. You would actually think that we could take all of this data, do something with it that's useful to patients, and go out and make the decisions that we're able to make on refrigerators and cars, general appliances, but that hasn't happened yet. So what happens when patients don't get the information that we need? We go on and we make our own opportunities. So I joined Facebook, I think, I can't even remember what year now, but it wasn't to look at my friends' children's pictures or my relatives or to connect and make friends. It was because as a patient, I couldn't get the information I needed. So I started a patient group. I actually have 2 online. One later became a 501c3 that's a foundation. The other one still has 17 patients online actively sharing information. So patient groups in this country, there are now 7,000, and I'm not sure we actually need any more, but every time a patient steps forward and they don't get what they need, they're still going to try to get answers for themselves and for their child. And so we really need to figure out how do we integrate people and help them get what they need out of the system, and so we can stop going off and creating all of these different activities. Some of these patient groups are really amazing. Some of you are sitting in this room. You've gone on to create clinical trial networks, registries, biobanks. It's the data that's being shared. We have patients like me that we heard Sally speak about yesterday. If you go online, patients want to do something with this data. They want to do something with it now, and we're going to do it with or without you. So with that said, the other thing that's happening too is patients are getting more involved in the research endeavor. We're running into all the same issues that you are with IRBs and with contracting, with thinking that we've made an investment in these dollars and then having an investor getting saying, I'm sorry, I know I submitted this budget, but I can't do the study for what I said, so I'm either not going to finish the study or you can send me more money. So patients are getting very results oriented, and we're demanding more and more from the system, and we're taking control of that. My day job, I work at Clinical Trials Transformation Initiative, which is an FDA public-private partnership to improve the quality and efficiency of clinical trials. And I actually do patient engagement, and we bring patient groups to come together with all the different stakeholders in the research enterprise to affect systemic change. We do believe that together, all of us linking arms, we can make progress on some of these IRB issues. I think I heard every single person yesterday say, we're dissatisfied. So all of us, if it's not working for anybody, it's time for us all to link arms and right now, make a change through a learning healthcare system that actually works for all of us. All right, can you advance me, please? So I want to give you just a quick example of why we need each other. So patients we're online, we're reading all kinds of things, and we really, if we go off on our own, we don't have any idea what is good evidence. And so we might read an anecdote, we might read a single case report, and when you start looking at scientific evidence, can you click 1, 2, 3, 4, 5 times, please? This is what happens. Click again, please. This is what it translates to us. We really don't know, and so we do need to all pull together and support each other. So now we're seeing the patient-powered research networks crop up, where we've got folks that actually have backgrounds in statistics and IT, and they're saying, you know what, I'm going to take this data and I'm going to make it work for patients. So this is just one example of many out there, patient-powered research network. We've heard Sean go out and speak about this, and you want something back. So as you're putting your data in, we actually want some type of feedback. We want to know that it's making a difference. We want to benchmark ourselves. You want to benchmark for quality? We want to benchmark ourselves, and we want to know how we're doing in comparison to other patients. We want to know what medications people are on, and we want not the real, the clean population. We want the real world. Most patients are on much more than one medication. So this gets into, now we've got our networks, and how do we make that work for patients? The cancer world has been doing this for quite a long time. I know we've seen all the things on the learning healthcare system. We talk about it at all the meetings I've been to, I think, in the last maybe 2 to 3 years. It's kind of interesting. I never actually knew Sarah Green was the one who worked with her team to create the cycle, which I think is fabulous. This is just a similar thing. where we know that patients are coming together to create these user-designed systems that actually, they meet the triple aims, and they also have been shown to reduce care and spending. It is starting to be documented, and I do think we need to have more conversation around metrics, and I think you guys can help us figure out how we're going to measure that we know that patient engagement and research actually works. I look at PCORnet as a living laboratory, and I think we're actively collecting this information. Hopefully in 18 months, we'll have more to give back to you. But it's not a new concept. It's just, it's time to actually act and to do it. So I hear from some groups, why would we actually, how are we going to sell this? How do we become a network? Why do patients want to be involved in a learning network? Why do they want to participate in research? So there's plenty of studies that are out there by Syscript and by Research America that actually show that most patients have asked, they would probably participate in research. It's just that we never ask them. And so I think you guys have the opportunity to link arms and spin the positive. I would hope that in another year or two in this country, patients are going to know whether they're in a learning healthcare system, if they're part of PCORnet, if the system that they're coming to is actually part of PCORnet because it's been branded that well and we know enough to ask. But it's a benefit, and we need to really communicate to all patients that if patients like us aren't in research, then the research results aren't going to be applicable to patients like us. It's a simple case, and I don't know why we get so hung up on all the whys of why we can't do it. We shouldn't tell people about the knowledge we don't know. We should be raising awareness every single day. If a patient comes in an office and they get what they need, we walk away with their treatment. If we go to the shelf and we never have a question, then we never know what else is out there and what doesn't exist. And we need to all be linking arms and raising awareness about that. And we also, for providers, we really want patients to know that they're part of an engaging system that is actually learning from us. I'm the 1%. I look like a normal person. I have every complication known to man every time I have a procedure, and it's kind of ridiculous. And I walk away from that going, God, I hope that somebody else doesn't have to go through this. At the very least, I hope they learned. So I know I have one thing that actually got published as a single case study, but short of that, I don't know what happens. And I really hope that other investigators and clinicians can actually learn from that and not have another patient have to repeat some of these things. Next slide, please. So we hear a lot of challenges to patient engagement. We don't know who to engage. How could we possibly do it? There's no one-size-fits-all patients. They're patients with low health literacy, so we don't know how we would actually go out and engage with these people if we have these stakeholder advisory boards or involve them in governance. Here's what I'll say. Right now, again, PCORnet is a living laboratory. We're working on it. Until then, better than zero. Stop. It can't be zero. We can't do it because it's too hard. So try something. Ask your buddy. We've got people that are actually doing it, and we are going to document it at PCORnet. But for now, just start with something. We have models. I review PCORI actually in the communications and dissemination area, and I see all kinds of innovative things coming through. And people are actually able to go out in the community, get people that have never heard of research, that have low literacy in general, low health literacy, may not even speak English, and yet they're able to find meaningful ways to engage them. So if you don't know how to do that, ask around. There are others that do, and hopefully we'll have more evidence in the future. I will say that stakeholders and engaging them, it requires care and feeding. It's not just we pop up this board and then we call them to a meeting and we expect that to be an effective engagement. So you really do have to support these folks and give them the tools to participate. We also need to train our investigators to reach out and be able to work with this group. Next slide, please. So we've already touched upon this, I think, several times about why we should engage patients in research and in infrastructure development. So we know that they're bringing their personal experiences. Urgency is obviously a big one, but then, so we talk about the research uptake, what happens, we do all this research and then you put it out in the community and nothing happens, or people actually, they don't respond to it at all and we wonder why. Why is it that we did all this research and nobody's actually using it? And I think a key thing to start from, next slide please, and hit one more, is just trust, transparency, and honesty. It's very basic. If we start from that, then I think everything we do going forward as we figure out these other things is going to be fine. So we also need you all to be the messengers. I see the same faces at a lot of these meetings. There are a lot of people that aren't coming to this room, and we need to help you get the message out. We are changing culture right now. We need to promote the culture of research. We need to know why your systems are doing it better than everybody else and why they're working better for patients. So help us get the message out. I want to quote Josie Briggs, who I think it's amazing, from the patient perspective. And then I hear somebody so high up at NIH say, we really need to raise awareness about what's not known in medicine. I can't hit this point enough. Please help patients understand what's not there. Nancy Cass said it, really yesterday. If people aren't actually asking questions and saying, "What do you mean you don't know that?" It's because they don't know. So please tell them, and we will help create that culture of research. And then also be sure to celebrate folks. I think, was it Dr. Gartwaite that was talking about people from his hospital that had participated in reduced MRSA study and how proud the nurses were. Celebrate these folks. They're getting involved in research. Make sure that they actually are celebrated as the heroes. So in sum, basically, we have a lot of opportunity. Everything about patient engagement is not completely solved, but that doesn't mean that we don't do it. We need to stop coming to these meetings where we say, okay, we've been talking about this for 25 years. Why aren't we making it happen? Today is when, well, it's not today. When do they send out those proposals? It's been a while. Anyway, we've been making it happen, but we need to, dig our feet in the ground and say that together we're all going to change these issues. We are actually making progress, and now is the time. It really can't wait. Thank you.